Part of the differential diagnosis of frozen shoulder is ruling out subacromial impingement syndrome. We will be doing the following impingement syndrome tests. The first impingement test is the Neer's impingement test. In order to properly visualize the shoulder joint, I'm going to ask the patient to remove her shirt. Please bring your arm all the way up in front. And I'm stabilizing the scapula and providing overpressure at her shoulder. Do you have any symptoms? No. A positive test would be provocation of symptoms or pain. The next impingement test is the Yoakum test. Have the patient put the involved hand on the opposite shoulder. Have them bring their elbow up towards the ceiling. Do you have any pain or symptoms? Next, apply slight overpressure. Do you have any pain or symptoms? While stabilizing the scapula. A positive test would be provocation of pain or symptoms. The next test is the Hawkins-Kennedy test. Bring the patient into abduction and shoulder internal rotation and stabilize the scapula. Provide an internal rotation overpressure. Do you have any pain or symptoms? And now to provide a more vigorous test, you bring them into more horizontal abduction and provide the internal rotation over pressure. Do you have any pain or symptoms? Okay. A positive test would be a provocation of pain or symptoms. The next impingement test is the empty can test. Have the patient put their thumbs towards the floor and be in the scapular plane. Now bring your arms all the way up to the ceiling. Do you have any pain or symptoms? Now have them come halfway down and provide resistance. Hold, don't let me move you. Do you have any pain? Any symptoms? A positive test would be provocation of pain or symptoms. The final impingement test is the painful arc test. Have the patient bring their arms out to the side and bring them all the way up. Ask the patient to indicate if they feel any pain and when they feel it. A positive test would be pain or symptoms between 60 and 120 degrees of the range. There is conflicting evidence about which test is the best test to rule in or out shoulder impingement syndrome. However, many studies have shown that Hawkins-Kennedy is the most reliable. Other studies say that a combination of the tests that we have shown are the best way to properly diagnose shoulder impingement syndrome. We would perform all of these tests bilaterally in order to compare baseline.